And that's a good segue though too, Jeremy, that taking those behaviors and redirecting them into something positive. So one of the things that we've done with our son is when we notice that he's kind of ramping up, he has some
becoming anxious,
becoming more anxious about a situation or even something that's not in the present, but something that he's dwelling on. And we've begun to kind of redirect that, and we'll say, I noticed that you seem to really be having a difficult time right now. Do you need a hug? Because the pressure helps him to calm, and then I intentionally adjust my breathing pattern to help him to calm down. And then we'll offer, do you need some time and space to do some of your martial arts? That has been incredible for him too. Or some time to beat on your drum set. He's a percussionist. Yeah. That seems to really help to recenter him. Or time to read. And those are some things that sometimes he sees it and he can take charge and do it himself. Other times he needs help to remember those tools are available to him.
Yeah.
But reasoning though, really quick, reasoning with some of these kids is very difficult. And especially the ones that lack that communication skill. And so it might be easy for you to do that, with your child, because they can understand that reasoning. Some don't. And that's frustrating too.
He does not reason well when he's anxious, actually.
But I'm talking about understanding the thought process, like understanding the communication and that reciprocal communication, where there's some parents that don't get that at all, or there's some parents that get a little bit of it sometimes, and they can understand some things, but for them to really go that far in it, a lot of them don't.
Yeah, no, you're absolutely right. And I do feel like we are blessed, lucky in that my son does understand those things. I have also been lucky enough to work with kids and adults that don't have that skill set. At the equine facility where my son was before COVID, we volunteered there and got to work with the other riders as well. And we, as a result of that, did get to learn some really great coping mechanisms for them. I mentioned the hug, the deep pressure is.
My daughter likes that too.
Yeah, it's huge. Yep. And
we called it big squeeze.
Big squeeze. I love that. And regulating my own breathing. And that can be challenging sometimes, because when my son is having an anxiety attack, it's not really an anxiety attack, but when his anxiety is ramped up and he's struggling, I have to be really careful that I don't pick up on that. And I keep my own breathing nice and calm and steady, and that his increase doesn't result in my increase, because then his is more and then mine is more. And then
sometimes, depending on the situation, that's easier said than done. But I know what you're saying, when you can get yourself to be level.
Yep.
And you're not feeding into their anxiety. I deal with anxiety myself. Okay. So I understand that's why sometimes it's harder for me to do that, but I understand what you're saying, because they feed off of that.
Yes.
And if you're more calm, they will settle down easier. Now that depends on the child too, but I think the anxiety is a big issue with these kids, but they just can't tell us.
Yeah.
And I know I've had, panic attacks on and off since in my 20s, been on medication on and off. And so she can't tell me how she's physically feeling per se when it comes to anxiety. If her stomach hurts or something, like her foot hurts or something like that, she can tell me. But like with the anxious feelings, I know she's anxious. Why would she be doing the repeating and trying to self-soothe and all of that? But they can't necessarily tell us, and especially the nonverbal ones can't tell us.
Right. No.
And it all comes out in behavior.
Yes. And my son doesn't ever come up. I don't think he's ever come up to us and said, I'm feeling anxious. That has never happened.
Yeah.
It's all the behaviors. That was an hours long meltdown. Golly, we haven't had one of those in a while. Okay,
Yep.
you went and sat in the corner of your room, curled up in the fetal position. Okay, something must be going on. Let's figure it out. It's all
Right.
behavior.
Hey, you're ripping the covers off of your books. You know those are your books, right? No, stop. Stop ripping the covers off the books. What are you doing?
Yes. It's all based in behavior and what we see. And my son, you mentioned that your daughter wasn't verbal until she was about 3.5.
Yep.
Son wasn't verbal until he was 4. But prior to that, we managed to be able to teach him a good amount of sign language. And
I did the same thing with my daughter. It was the precursor to words.
Mm-hmm.
Yeah, and for my daughter, it was only a few. It was eat, all done, more. I remember more was the first one, and she did it like this when she first said, I'm like, close enough. You got it.
They're so cute when they do it their own way.
Yeah.
We had, goodness, I lost count.
Very important.
It was so wonderful. And I lost count of how many words we ended up, but we taught him. He would have meltdowns, just massive, throwing himself on the floor, screaming meltdowns as a toddler, because he would have been, pointing and grunting, and we're guessing everything. And so we taught him.
You got to figure it out.
Yeah, right. You got to guess. But then they get so frustrated that you haven't figured it out yet that they lose all ability to tell you whether or not you're right. So we taught him the sign for sign. And then he could ask us what the sign for something was. So he'd pick up a train and ask sign and point at it. And so we just everything he brought us, we taught him the sign for it. And it was,
I never would have thought of it that way.
That's
interesting. That's interesting concept.
It was it allowed him to communicate with us. We never got to a point where we were communicating in full sentences or anything like that. But if he could tell us even 3 things that he could sign, it was, our day had 3 massive meltdowns instead of 12.